Hey, you guys, this is an office space that you guys haven't seen yet. This is one of our neighboring offices where we have our photodynamic treatment room. And this is quite a specialized room with really, really expensive equipment. And we just want to show you guys what to expect from your treatment. So first of all, after your 2 hour or 3 hour visit, you will come back to this room, and then the nurses will bring you and accompany you to this room. And this is where we will then cover your eyes. Now, depending on the treatment that you're going to get, if we're going to treat or if we use the red light therapy, we use this eye goggles to cover your eyes like this, and this is an elastic band at the end. And then this is the red light machine or the Actilight that we will use to activate this medication. Now, this is not a griller. This is not something where you can turn on the dial. This is literally, and I'm going to start it now, it's literally just red light. And when you come in, if I would sit, the nurses will put this very, very close to your skin. Actually, the closer, the better. And literally, I don't feel anything because there's no medication on me. And of course, hopefully, I've been a good boy and I don't have any precancers on my skin. But this is literally just red light. There's no radiation. There's no heat generated with it. But of course, when you're sitting with this red light on your skin, you will feel some stinging, some discomfort, and that is normal. That is those precancer cells that's dying. Now, of course, the normal skin and the areas where we'll have this blotchy appearance, nothing will happen. So you won't feel it everywhere. Of course, it depends on how many precancers you have. If you have a lot and it's widespread, you probably will feel that pain and discomfort everywhere. And that's where we've got a few things that can help you. The first one is, of course, you've got your nurse with you, and make sure to let her know how the treatment is going and how you're feeling. We also have this fan, and there's 3 speeds to it. And when you blow it on your face or the area that's being treated, that can make a huge difference because that cool air can actually help with just the little bit of discomfort or more discomfort that you're experiencing. The nurses also might offer some water where they can literally spray that on the area that we're treating while you're cooling it down with a fan. And that's, again, just to make it as easy as possible for you, because of course we want to make sure that you're comfortable. The other option is where we use Levulan, and this is our blue light machine. So this is the blue U, it's a U. And this is where we will position you either in different positions to maximize exposure. And we use different goggles for the blue light. So this will be the goggles that we will literally put on your eyes to make sure that we protect your eyes. And then what will happen is I'm going to change this chair around, but the nurse will switch it on, and this is 17 minutes. The blue light is 17 minutes, where the red light is about 7 to 8 minutes. So if I switch it on, it's quite bright, and you will basically sit like this and expose yourself. And again, it's just blue light, and there's no radiation, there's no heat, but again, you will feel that there is something happening while you're having this treatment done. Again, you can ask the nurses, or the nurses will offer to spray you with cold water. You'll have your little fan, and of course that will help you to cool down the area that we're treating. Very important to communicate with your nurse how you're feeling and how you're coping with the treatment. Now, it's only the areas that is abnormal cells or precancer cells that will respond to these treatments. If it's normal skin, or if I put this medication on my baby's skin, and I put my baby under this blue light or red light, nothing is going to happen because there's no cancer cells. But of course, when we do these treatments, you will definitely feel that something is happening. After the treatment, depending on how it feels, we could definitely offer to put some steroid cream on your face if there's a lot of pain and discomfort. Hopefully not. And this is where the 3 prescriptions, we can actually fill that. The nurses will talk to you about that using Fusidin. That's the antibiotic treatment that you can use. If you struggle with pain and discomfort, there's a topical steroid as well as an oral steroid that we can use to make this treatment as comfortable as possible. But this is where your communication with our office and our doctors, of course, you've got access to your doctor 24/7 with their cell phone number. Please only in emergencies, but feel free to call if you're unsure, because we are there to help you all the way. And then typically 6 weeks after your treatment, then you will see your treating physician again, where we will do photos. And this is where we'll have the comparison to see how you actually did with your treatment and if we have to do any further treatments. Thanks for watching, and thanks for allowing us in your care.